Good afternoon, everyone, and welcome to the Safer Air Project's first webinar session for the year. It feels funny to say that in April, but great to be here. I'm Plum, CEO and founder of the Safer Air Project, and I'm so pleased that you could join us today as we explore why safer shared air in homes is important for us all and our health. Before we begin, I'd like to acknowledge the traditional owners of the land on which we gather today. I'm joining from the land of the Darramaragal people, and I pay my respects to elders past, present, and emerging. Please feel free to say hello in the chat and share the traditional lands you're joining from today also. Just a few housekeeping items before we get underway. If you would like to enable closed captions during today's presentation, you can do so by clicking on the three dots that say More at the top of your screen, going to Language and Speech, and adding Show Live Captions. The meeting is also being recorded, so if you need to take a break, please feel free to do so. You'll be able to catch up on our website in the next day or so. We're going to begin with a brief overview, followed by short introductions from each of our speakers. Then we'll dive into a panel discussion and finish with audience Q&A. Please submit your questions. Again, there is a badge that you can do so up at the top, and we'll hopefully get to them at the end. If we don't get to them, or if you're specifically asking a question to one of our panelists, you can email us directly, info@saferairproject.com, and we will get back to you. And finally, I'd like to thank our generous sponsors. A special thank you to our sponsors, AirGene, Camfil, Condair, and Precise Air. We're very grateful to you all for making this series possible. So, without further ado, let's get started. Today, we're turning our attention to our homes, the places where we spend most of our lives. While shared air is often discussed in the context of public spaces, and we did so last year in our webinar series covering healthcare, schools, and workplaces, today we're going to be focusing on our homes, where we all spend most of our time. This webinar will explore how indoor air affects health and well-being in domestic environments, particularly when infections are present in the household, when family members are at higher risk, or when issues such as mold and other pollutants are present. Today, for example, I'm 5 kilometers downwind of a planned burn, so I'm trying to keep my home and my work environment safe from smoke, and I'm grateful for the air purifiers that are doing a great job in my home. I also noted a paper that was shared with me last week showing that using in-home air purifiers can boost brain function in adults over the age of 40. So fingers crossed, we're getting multiple benefits today. We'll also be hearing about the latest research and lived experience, and our speakers will discuss what people can do to improve the safety of their home environments. Our first guest today is Professor Rebecca Bentley. Rebecca is an internationally recognized researcher working at the intersection of housing, the built environment, health, and epidemiology. She is director of the National Health and Medical Research Council Centre for Research Excellence in Healthy Housing, leads the Victorian Community of Practice of the NHMRC Healthy Environments and Lives Network, and sits on the Global Commission for Healthy Indoor Air. Most recently, Professor Bentley's scholarship has been recognised by the Faculty of Medicine, Dentistry and Health Sciences at University of Melbourne with the Dame Kate Campbell Fellowship. Congratulations, Beck. So if we can bring Beck onto the screen. Hi.
Great, thanks, Plum.
Over to you.
Thank you. So just to give a bit of a brief overview, my lens into this area of research is around healthy housing. So I've been working in the healthy housing space for maybe 15 or so years now. And what really has struck me working in the space is this area of indoor air and in-home exposures around the environment and what impact they're having on our health, not being something that we understand well, that is visible and that has been well quantified in terms of the consequences for our health at a broader level, and that's at the population level. So what's it costing us? So I just thought briefly by way of introduction, I would share a slide or three just to frame my position on this and maybe use it as a starting point to generate some conversation. So what we have here is a summary of the World Health Organization evidence with some additional information that our research group has developed about our understanding of how home environments impact health outcomes. So basically a summary of the evidence. And what we can see here is pathways between mold and damp to mental health and respiratory illness. And we can see pathways from mold and damp to indoor air quality that then leads through to effects on respiratory illness. And we can see pathways from toxic materials into indoor air quality, which then leads to respiratory illness. Now, this is a really useful starting point, but what it really doesn't tell us is how these home environments, the conditions within home environments interact. So it generally takes the pathways as being very specific, and it doesn't tell us about what the drivers are, so how people are being sorted into these home environments. So specifically to indoor air quality, the things that are on our radar in terms of the health impacts are pollution from the outside coming into our homes, affecting indoor air quality. So, Plum's talked today about bushfire smoke or smoke from burn-offs coming into her home. Mold and damp within homes. So where problems arise with dampness indoors leads to mold problems. That is a significant problem for health. Air quality being, fresh, not low concentrations of CO2, not bearing loads of viruses. So that sort of air quality is also a really important issue. And those issues obviously surfaced in relation through COVID. And we've learned a lot since then about how we can maintain healthy indoor environments. And interestingly, it is a really, homes in particular are really important in this space because it's often where we're not wearing masks and where, we're being exposed to the air and viruses and things from our families. And then finally, gas cooking in homes. So using gas appliances and gas cooking can generate things like NO2 in homes that can lead to health problems. So we know this, and I think people talk about this more in relation to apartments, but I think the lens that I wanted to bring today in particular was, well, then how do we end up in this? Like, what are the structural and social causes of us being in homes where there are these kind of exposures? So here I have what I call the social determinants of health framework, where we think about our housing system and the drivers of where people live. And if we think about issues like affordability, security, and suitability, upstream of things like home environmental exposures and indoor air, it's an important part of the conversation we need to have about how we might shift exposures for populations in terms of improving air quality and reducing inequalities in those exposures. So just again, as a conversation starter, here I have some data from 2022 where people were asked in a survey if they had mold or damp in their home. So this is an objective measure. This is just a survey. This is what respondents say. I wouldn't, test the quality of these data too severely. But what I would say is it does allow us to compare across states and territories and also look across tenure types. So we can see that depending on how people are occupying their homes, so if they're homeowners, private renters or public renters, their likelihood of being exposed to mold and damp in their home is different. And if, for example, we look at New South Wales, so the first state on this graphic with the most reported mold in homes, you can see that in the public rental sector and the private rental sector, the prevalence is a lot higher than for homeowners. And the reason I put this up as a conversation starter is it actually shows us how the structures, the way that we provide housing, the way that this varies by state and territory are important parts of the conversation we need to have about how we can shift to healthier home environments. A lot of people might be familiar with this case, but in 2020 in the UK, a 2-year-old child, Awab Ashak, died as a result of chronic mold exposure in his bedroom. He was, the coroner ruled that the cause of death was due to the community housing provider not remedying the situation in the home. So the family had reported continuously that there was mold and there was mold in the bedrooms and it was quite severe. And as a result of that, there's been significant change in the United Kingdom and upgrades in policy. We now have, as of October 2025, what's been called Awab's Law, which is that social housing landlords must rectify hazards within a certain time frame, and it's quite strict. Now, while we do have minimum standards in rental in Australia, if you think back to the mould graphic that I just showed you, there's still clearly issues that need to be addressed in terms of exposure. So I'm putting these things up here as a bit of a conversation starter. And what I often say in relation to this is we don't want a tragedy to drive change. So we don't want, you know, the fact of there being a death in housing to actually lead to the next phase of thinking about indoor air quality in housing and what that might mean for health. So thank you, and I'll stop there.
Thanks, Beck. That was fantastic. And what a great presentation. I'm certainly looking forward to digging into the data. And I think you're absolutely right. We need to be applying a precautionary principle approach here, not waiting for tragedy to strike, but we need to be applying policies that can actually make our homes healthier now, rather than waiting for a tragedy to drive that policy change. So yeah, looking forward to talking about that in a moment. For now, I'm going to bring on Pippa. So Pippa Soccio is a senior research scientist at CSIRO, where she leads the Social Impact and Living Labs team in the Energy Performance Group. She heads the apartment energy behaviour study, a 4-year project monitoring energy use, indoor environmental quality, and design factors across 430 apartments nationwide. And I'm really excited, Pippa, to hear about the work that you have been doing. Pippa has a PhD in architecture, building science, and views indoor environment quality as a multi-sensory design challenge, and advocates for holistic biophilic approaches that link energy efficiency and occupant well-being. Her award-winning renovation, Pavone House, received the 2023 National Biophilic Design Award for Interiors and Renovation from the Australian Living Futures Institute. And we're delighted to have you here today, Pippa. Thanks for joining us.
Thank you, Plum. I trust that my share, you can see my screen? Yes,
yep, that looks right.
Great. So that was a fantastic overview, and I'm going to, in 5 minutes, give you a snapshot of the work that I'm doing here at CSIRO as part of the Apartment Energy Behaviour Study. So for context, this is a study that is running for 4 years, and it was set up in 2023 in collaboration with the Department of Climate Change, Energy, the Environment and Water. And what it's doing is it's testing the assumptions in NatHERS, which I'll explain in a moment, about how people use energy at home. So we're specifically focused on occupant energy related behaviour, which relates to people's cooking habits, their use of appliances, their use of heating and cooling, and also their opening and closing of windows. So if you've ever renovated or been involved in building a home, you may have experience with the National Construction Code, which has a section J, which sets minimum energy efficiency standards in Australia. And one of the ways that you can meet those minimum standards is by having your energy assessor undertake a NatHERS energy rating, and NatHERS stands for Nationwide Housing Energy Rating Scheme. And this applies to every new residential building, both Class 1 and Class 2, and any renovation which is more than 50% of the floor area. So it's important to understand that NatHERS is a regulatory scheme. It is managed by the Australian government, and CSIRO is not NatHERS. We manage the back end of the NatHERS, the kind of algorithms that do the calculations. And this is what we call the Cheneth engine. And it has a whole lot of excellent science dating back to as early as 1945, when we started first doing work in building physics. The piece of this Cheneth engine that I'm working on is about occupants and understanding occupant behaviour. And just as an opening, it's to say there's no assumptions about air quality inside NatHERS, other than to assume that people open their windows in optimum conditions. So basically, a lot of things have changed since we first started looking at these assumptions, 1945 through to our lifestyle now in apartments and looking at the growth of the apartment market. So this is a study that basically set out to recruit 430 apartments around Australia And what we've actually done is completed the fieldwork last year. We actually hit 450, so we went slightly over. And as part of this project, we're monitoring 900 bedrooms and living spaces inside 450 apartments across 90 apartment buildings in 4 Australian climate zones for 2 years. So it's a huge amount of data that we're collecting. And the question is, what are we monitoring? So I'll quickly explain that we're monitoring 2 zones inside every apartment, and this is irrespective of the apartment size. We're only looking at 1 bedroom and the living space. We've installed a Wi-Fi router. We've installed smart air conditioning controllers that tell us about how people use aircon. This device also picks up a range of thermal comfort and air quality data at 1-minute intervals. We've got window sensors, which are telling us about how often people open and close their windows. We have a motion sensor that tells us if they're home. We have an indoor environment quality sensor in both the bedroom and the living space that tells us again about thermal comfort, carbon dioxide, also background noise and light. This collects data at 15-minute intervals. We've also put 75 PM 2.5 sensors into a subset of apartments. Again, I can answer questions about that. We undertake a LiDAR scan of every apartment, which is basically a 3D model that gives us a high level of resolution, right down to furniture placement. We have an installer that completes a spatial and appliance audit. And at the same time, we have a participant complete a lifestyle survey, which tells us about their lifestyle, their values, about who they are, who they live with. And then we are in the process at the moment of running pulse surveys every month, where we ask people 1 question about a certain behaviour. And then separately, we have an electrician come and put an energy monitoring device inside the switchboard that's collecting data on 6 circuits. So it's pretty comprehensive. So in 1 minute, I'm going to tell you about 3 things that we've learned thus far, noting that this is not primarily a study about air quality. This is a study about energy, but I recognise the relationship between indoor environment quality and our energy use. So as part of our lifestyle survey, we asked our participants if they had any problems with mold, condensation or damp in their apartment, and 23% said yes, 15 or so percent said unsure. What's interesting is this is about 30% of the population in apartments who have either seen the evidence or are unsure of what to look for. And I'm interested in looking at the relationship between this and what Beck just showed us on her own slide. We asked people the question in a pulse survey recently if anyone in their household regularly engages in activity that changes air quality. And we gave them the option to select all that applied. We had 414 responses. 150 responded with no relevant activity, so they do not change the air quality, while 2/3 do at least 1 activity to change air quality. And basically, almost the numbers that really surprised me were the number of people cooking without using the exhaust. So the top activity is candles, incense and aromatherapy oils, and then the number of people cooking without using the exhaust. And also you can see the numbers in front of you, but this was what people reflected on how they were altering air quality in their apartment. And then the final one, which actually relates back to the monitoring. So again, these are just 3 high-level findings of the study thus far. We are monitoring carbon dioxide in the apartments, and what you're looking at right here is this is 1 apartment overnight and carbon dioxide, and this is emerging as a bit of a trend. The carbon dioxide is about 500 parts per million when they first go to bed, which is quite good, and by basically just before they get up in the morning, which is around 8 o'clock, it's peaked at 2,800 parts per million. And then the steep drop is evidently when they've opened their bedroom door. So so this is 1 case in 1 apartment. But what's interesting is when we look at all of our data, which is what I've highlighted in the blue, is overnight, the level of carbon dioxide inside our apartments as a whole sample shows 60% of apartments overnight in bedrooms have carbon dioxide levels, which would account for complaints of drowsiness and headaches, fatigue. So the point is, I think we have an issue, particularly in apartments at night, with people closing the door and not having any form of ventilation, and it could potentially be taking away from the quality of their sleep if you consider that kind of lots of oxygen in bed at night will help with cognitive function and how good you sleep. So look, it's a really fast snapshot. I'm out of time, but I am happy to, again, contribute to this conversation. And outside of this, if you'd like to talk more about it, then please get in touch. Over to you, Plum.
Pippa, that was a fantastic overview, and I'm sorry to give you such a small amount of time to talk about such a big study. I think one of the data points that you showed on the screen there about the things that people do in their houses to affect the indoor air quality, the one that surprises me is that there are already so many people using air purifiers. I think it was it 64 who were already.
Yeah, that's right. 64 identified air purifiers. They're using them. What's interesting is only 16 of that population said they were only using air purifiers. So a number of people were using purifiers, but then doing other things to alter their air quality. So I haven't digged into it yet.
Yeah, there's a funny way to kind of look at it, isn't it? There are the things that they're doing to make their air quality worse,
exactly.
And the things that they're doing to make it better. And actually those ones who are not doing the burning or they're already making it better. And then they're using air purifiers. So there's obviously a group who do really understand this. It's fantastic. Thanks so much. I'll look forward to bringing you back on for the panel discussion. So our last guest is Jo Reynolds. Jo has a complex web of health problems, multiple of which intersect to make safer indoor air a crucial priority. Amy and I first met Jo when we launched our Safer Shared Air resources for the Immune Deficiencies Foundation Australia community. And we're delighted that Jo is able to join us today to talk about why safer shared air matters to her. Thanks, Jo. I've got I do have hang on, whilst I will just stay here for 1 second, I'll make sure I'm sharing the right screen, and you tell me when you would like me to put it on.
Great, no worries. Yeah, that looks great, but we won't need it for a moment. Thank you for having me and for that lovely introduction. As Plum mentioned, indoor and outdoor air quality and safety is a very personal matter to me and my family because both my child and I have a primary immune deficiency. Sorry about that. Something fell down in the corner. I also live with a paralysed right diaphragm, so reduced lung capacity. I have myasthenia gravis and lupus, so multiple autoimmune diseases. And this combination of immune deficiency, autoimmune diseases, a paralysed right diaphragm, all together make me very high risk for further reduced breathing capacity, both from pollutants, from infections, and anything that stirs up my immune system, really. And I don't have an adequate cough to clear my own lungs. So once things start going wrong in my lungs, that will snowball really quickly. So I'm really concerned about infections, but I'm also concerned about remaining sick and passing infections on to other people. And I'm concerned about other aspects of air quality like pollen and smoke, not just infections. Also perfume and mold, but we've been working very hard for decades to keep mold and perfumes out of our home, so it's not often front of my mind anymore. My husband is like a walking mold detector. So I'm here to talk about what my family does just from a one family's perspective to stay safe at home. We use multiple air filters in our home. Each of them are sized for the room. We maintain them properly. But something else that we do, which is what these photos are about, is we manage airflow throughout the house using exhaust fans, doors, and ventilation strategies, particularly if somebody is unwell. And this is a strategy we first came up with trying to protect our family if anybody came down with COVID, which eventually did happen. And we have successfully prevented any forward transmission within our household of any COVID or respiratory infection since we started using these strategies. When we've had forward infection within our family, it's been quite clear that that has happened in the car before the person was aware that they were sick rather than inside the house. Cars are really hard, and my family should be better at wearing masks in the car, but it's really hard to remember to wear masks all the time in the car with your family when everyone seems like they're well. So that's probably our weakest link at the moment is the car. So Plum is going to show you when we started coming up with a way of creating positive and negative pressure zones within our house as cheaply as possible. My husband went to Bunnings and he bought fans. And we happened to have some bike boxes in our shed because we'd recently bought a bike. And he built exhaust fans into these bike boxes. It took him an afternoon. There's also gaffer tape involved. And basically anytime someone was incredibly exposed to an illness or appeared to be unwell, these we have multiple of these fans, and they would be put into different windows in the house depending on how close together bedrooms were between well people and possibly infected people, and air filtered. So, you know, we would have this rapid mobilization to get negative pressure in some rooms, positive pressure in other rooms, relocation of the biggest and strongest air purifiers to outside appropriate doors or inside appropriate rooms. And this has been really effective for us, including when my husband had COVID. He was incredibly sick. If it hadn't been the middle of one of the great peaks in Melbourne, he would have been in an ambulance on his way to hospital. Instead, I, with all the health problems I just described, was caring for him myself. He wasn't able to lift his head or drink without assistance. He didn't move from bed or go to the bathroom for a number of days. So he was very, very unwell, and I was going in there and caring for him and did not catch COVID from him. Obviously, I was also masking up and taking other precautions, but the air management we credit with being quite a significant part of getting through that experience. So I guess the point for me of bringing this up is this was a really low expense, quick afternoon DIY thing that we then stored in the shed and brought out whenever it was needed, and has been really successful. Like, solutions don't have to be expensive, and you can come up with things yourself, even as renters. We were renting this house. So hopefully, whether it's this idea or something else, people will realise there are things that they can do even in rental properties to keep themselves and their families safer. We do also use an Aranet CO2 monitor, and that's had real impacts, in particular on our teenage children's behaviour. Teenagers don't necessarily want to hear from their parents what is safe or not, but when we put the Aranet in a bedroom and gave them some basic numbers about what was safe and what wasn't safe, all of a sudden their behaviour changed. Their windows were open a lot more, their doors were opened a lot more, they stopped putting towels to block the airflow along the bottom of their doors. So using our teenagers didn't delve deeply into the science. They weren't really that interested, but just having a monitor and looking at the number and going, oh, 2,000, that's bad, I'll open a door, has really changed things and has impacted the health, I think, of our children, that they're monitoring their own behaviour with the use of a CO2 monitor. The other thing that I wanted to talk about briefly is that we've moved from a rental home in Melbourne very recently to a stone cottage in Adelaide that we're renovating at the moment, and it's a really different house. And what we will need to do here, and the choices that we make about renovating, are probably quite different than what we would have thought we would do, say, 10 years ago. Because the last 6 years and what we've learned during the process of worrying about air quality and COVID and understanding the greater details of my own health problems has really changed our perspective on things like air tightness and safety. You know, I think retrofitting, double glazing and tightly sealing old houses as hard as you can is something that I was raised on, this idea that we should retrofit as much modern glazing and air tightness features as we can to reduce electricity costs and environmental impact. But I think very little thought has been given in Australia to the health of the building that results from doing that. Because if you're not also installing mechanical heat recovery ventilation, then you're sealing all the bad air in, and that's not something that we would choose to do anymore.
Hopefully that's something we can get into with Pippa, whose study is looking at energy efficiency and indoor environmental qualities. So perfect segue, Jo. Thank you so much.
Thank you.
To bring us to the panel discussion. So if we can bring Pippa and Beck back on. Hello, everybody. Hi. So thank you everyone. Thank you so much for your really thoughtful comments and also for sharing the research that you're working on. My first question is going to be for you, Beck. Jo's experience reflects what a lot of high-risk households are living with, including my own. What does the evidence that you've been looking at tell us about how home environments are really shaping those health outcomes? You mentioned about how renters. We saw on the graph that you shared, renters have a greater exposure to mold than people who own. What else are you seeing in the data?
Yeah, look, I mean, there's two different sort of lenses to put on this. I think the first is that we're starting to understand more and more how things like humidity, temperature, and other things are interacting in homes to create environments where there is more, say, transmission of diseases or the air quality is poorer. There's certainly a lot of evidence coming through now around, as Jo said, sealing homes up to create better energy efficiency, which has been a real driver and a real policy priority, inadvertently leading to the sort of conditions where we're going to increasingly see a legacy of damp and mold in homes. So a lot of homes are being built now to Energy Star rating standards and not really thinking about the health consequences of those standards. And I think that's going to be something we're really going to have to think about and reckon with. I think states like Australia, where we've had electrification pushes to get people using electric cooking in particular, rather than gas cooking, has been a real win. And it's going to be interesting to see over time how that improves indoor air quality and what impacts that's going to start to have on health. But I think the other thing that I'd like to say about it is in work that we've done with populations, and in particular some pilot work we did with people with asthma, people are reporting that sort of when they're seeking treatment for their symptoms or for their asthma, it's very rarely raised by their clinician or their healthcare provider. What's happening in your home environment. So consideration of home environments and how they could be modified, I think could be something that we do think a lot more about in terms of how we can, say, take the findings from Pippa's study and the experiences that Jo's having and actually start to think about prevention strategies and how we can protect groups in particular. And we're the evidence we've got so far is that we're not really seeing that.
Yeah, go ahead, Jo.
I just bringing together what you were saying about asthma patients not necessarily being asked about their home environments. One of the things that I immediately thought from Pippa's presentation is, the people who are reporting daytime drowsiness and are really struggling with the impacts of their poor sleep at night from their terrible air quality in their bedrooms. If they go see their doctor, they might be offered a sleep study, and perhaps that sleep study will show sleep apnea, or maybe it won't because they're in a different environment and actually getting better sleep in the hospital than they can get in their own bedroom. But either way, nobody's ever being offered, let's do a 3-day air quality assessment of your sleeping environment. And I think that that's something that should be, particularly if the hospital test doesn't match what the patient is reporting, there should be a question about, well, what's going on in your home environment? And that's just completely, that sort of environmental medicine is completely absent from patient experience that I'm aware of.
Yeah, I think that's right, Jo. I had, my young son, when he was having recurring bouts of croup, and we sort of were trying to go down this path of discovering, well, what's causing this. There was never a discussion of what's the home like, what's the home environment like. And when we moved from that home, it took a while, but the episodes have reduced, and now I want to touch wood, are very rare, and I'm confident that the home was the main driver of those illnesses. Pippa, you spoke about how your study is monitoring indoor environment quality across all of these, fantastic apartments. I would just love to be involved in the study. It really does sound like such a great opportunity to find out more about what's happening. What's the thing that surprised you most about the data that you're seeing?
So at the moment, because of the number of participants and the amount of data we're collecting, we are still very deeply in the data collection phase.
Mm-hmm.
So we haven't yet had much of an opportunity to really jump into the data and start analysing it. And there's also a reluctance, I guess, on my part to analyse too much of the data too quickly, because the reason we're collecting 2 years of data is to obviously build a kind of longitudinal picture of what's happening. But what has surprised me, or at least kept me entertained during the process, is the outcomes of these pulse surveys, which I run every month. I'm very fortunate to have built a strong rapport with my participants. I actively installed nearly 200 of the apartments, so I've been in and met a lot of the people. And as a consequence, the response rate to these pulse surveys has ranged between 80 and 95%, which is kind of like a dream for a researcher. And something that surprised me was over some warm weather in January. We had 43 degrees in Melbourne and 43 degrees in Sydney on kind of corresponding days in January. The range of thermostat set points that people were using. So it was 43 outside, and they'd set their thermostat between 17 and 27. So that was probably one of the more surprising outcomes. And also that example I give of the carbon dioxide, of what we're seeing in people's bedrooms. And perhaps it's also raised a sort of a secondary question for me around awareness that people have of when they either close their door at night because they're keen to, well, maybe they're in a share home and it's privacy, but maybe in some cases it's a particularly cold night and people are thinking, I'll close the door to kind of trap the warmth in the room, mm-hmm. or I'll run the split system and that's bringing in fresh air, and just kind of this knowledge gap, I think, about where ventilation is coming from. And it was something that Jo started to touch on, was, about air tightness. And this study, we are collecting so much information, but a couple of things we're not collecting, just for clarity for the audience, is we are not undertaking an air tightness test of every apartment. We entertain the idea, but it's not something we're planning at the moment. So we don't know what the air tightness of each apartment is, but my colleague Michael Ambrose has done some very detailed air tightness testing recently, which included apartments. Mm-hmm. And we did find that apartments were very well sealed in a lot of cases. So we think that apartments are probably more well sealed than a lot of detached housing is. So that's just one of the limitations of the study. And the second thing, there was a question about filters. Our apartments don't have air filters. We're trying to, when we first go in and do the device installation, we try to note down as many things about the apartment as we can. We note down fly screens, which I think is an interesting discussion point, mm-hmm. about people actually opening their windows, and the fast kind of low-hanging fruit to improve air quality and ventilation, I think, is for us to install ceiling fans and fly screens. And anecdotally, people told me, the developer told me that insects don't fly to the fifth floor. So therefore I don't need fly wire, or they don't fly this high. And I've actually heard that anecdotally from so many participants about being sold this kind of myth about not needing fly screens. I think that would help a lot. Mm-hmm. And also I think apartments are challenging because of the fact that they often only have a single orientation. So creating bouts of negative pressure and positive pressure to actually pull fresh air through the apartment is a challenge. So I think there is so much I can say about the study, but I think there'll be even more to say about it once we start taking a deep dive into the data.
I'm going to ask you one more quick question, just whilst I've got you on things to say about the study. I know I brought this up with you already, the study from London that was making the invisible visible, which is one of our favorite phrases, and Amy might pop the link in the chat. I know that your study is not making the data visible, but it would be interesting to hear your perspective on the results of that study. And are you seeing obviously you're not displaying the data, but do you think that you would see similar here, that if you showed people indoor air quality data, that it would affect their behaviour in these apartments?
Yep, so I'll say two things to it. The first is, for clarity, the reason we're not giving people access to their own data at the moment is we don't want to inform behaviour change. So the outcomes of this study will be very applied. They will likely see us make some changes to NatHERS being a regulatory scheme. You know, we need there to be absolute rigour behind the science. So we signed people up under the complete awareness that we would be collecting data in their apartments for 2 years, and we wouldn't be sharing that data with them. However, at the end of the study, we would provide each participant with a comprehensive report about what we learned about their apartment, including, you know, recommendations of how they can improve indoor environment quality and, you know, improve energy efficiency. So that data is coming, and I think there's a really interesting opportunity to actually possibly divide the future group into anyone that will continue with the study. We might be able to divide them into 3 groups and look at, you know, whether the report alone changed behaviour, whether the report and some degree of nudging change their behaviour, and whether or not like coaching kind of change their behaviour. So what might it take? But I will say separately, I've been involved in another study where we've been monitoring air quality, and to demonstrate to an audience the devices we were using, we actually showed them their air quality data after the first day of them being in the room together. And it's the first time I've ever seen 5,000 parts per million carbon dioxide. I think my device has actually peaked at 5,000, so it could have been even higher. This was in Tennant Creek in November, so it was 43 degrees outside, and basically everyone was shoved in a room with split systems on with doors closed, and everyone talked about how fatigued they were. And the next day when they saw their data, we actually said, hey, it might be hot outside, but you need to open the windows, you need to open the doors. And actually that visualization really helped inform that behaviour change.
Yeah, you've got to be able to see the data in order to be able to know you've got to do something about it. And I've found exactly the same with my children's school teachers. Once they had monitors to be able to see, they were then able to do something about it, you know, when it got bad. And also, you know, to balance thermal comfort as well. When, you know, in winter, if you're only aiming for, you know, under 600 parts per million of CO2, for example, you don't have to have the windows all the way open necessarily in window. You can have them a little bit, but you have to be able to see the data in order to be able to know where you are. Yeah, I think it's fantastic, and I'm looking forward. So when will your study report?
So the data collection finishes next year, but there will be some publications that will forthcome about some of our early insights into behaviours, lifestyle survey results. So watch this space.
We'll look forward to that, and we'll share them across our channels. Beck, we spoke briefly about, you know, home ownership and mold. What are the things that you think from a policy perspective can be done to help renters? What should we be doing to kind of bridge that inequity that exists between owners and renters, and also sort of private renters and public renters? What do you think we could be doing better now?
Yeah, so now, I mean, we do have new minimum standards coming online. There's variability across states and territories in terms of minimum standards in renting, and some states have better responses to things like tenants reporting mold in their property. But what we see is, even in states where there is a requirement that landlords act quite quickly, there's still often a lack of clarity around, well, if the source of the mold isn't clearly structural, then, you know, we're not necessarily going to act. So people can end up in disputes with landlords over it. So I think really tightening that up and really clarifying and tightening up the responses when you do have the minimum standards in place and enforcing them is something we could do, which also requires, I guess, landlords and tenants to have a really good understanding of these regulations and why. So, you know, that there are actually health consequences, because I think if a lot of people understand the health consequences, that a child with asthma could get sick or a child could get sick, they're much more prepared, I think, to do what they need to do to maintain a property versus just seeing it as an expense. So this is an expense, why, you know, but actually thinking more broadly about some of the reasons that these things are in place are related to health and protecting people. I also think that, Australia's housing system is really suffering from years of problems with affordability and security, and in the rental sector, insecurity, which means that renters don't feel like they can just move. And that's actually an important part of the story as well. So people are putting up with conditions that they perhaps wouldn't put up with if they had the ability to move. So addressing some of those issues is actually another important thing that we could sort of start to think about straight away. And I know that the government's building more houses, and I know that, minimum standards are coming into place, but really a lot of that's not happening from the point of view of health. It's not happening sort of broadly enough to address some of the need, and it's happening inconsistently across Australia. So I'd say another thing we could really do is think about federal level coordination of the rental sector. So how can we actually get the same standards applying and actually have fairly stringent standards in our rental sector across Australia, so that, as I said in my introduction, we're not dealing with, say, the death of a 2-year-old in housing through mold exposure to sort of drive the kind of change that we need.
Yeah, absolutely. I think one of the phrases that you used there were minimum standards. And I think, we also need to be doing better than minimum standards, right? Because if we're building to the minimum, we're still having, we're still going to create problems. So what are the best possible standards to ensure,
Yes.
and not seeing, going above and beyond as a cost, but seeing it as an investment in future health. I think is such a, we just need to kind of flip the way we sort of think about the whole sector. Joe, I've got a question for you, and then we'll try and get to we've got 10 minutes to go. Try and get to some of these questions from the audience. So do please put them into the chat. Joe, a question for you. When you're managing multiple conditions, making changes in the home can obviously feel overwhelming, and you've spoken about, managing mold and fragrances for a long time, and then obviously as your knowledge has grown around viruses and other airborne pollutants, you've kind of changed what you're doing. What would you say to others in a similar situation who don't know where to start? What's the sort of what's the easiest things that people could do?
Mold is really hard for me to speak to, because I've told this story to you before, but I've been with my husband for more than 25 years. And the first time we looked for a house together, one of the first places we stopped, he got out of the car, stood with one arm on the side of the door, one arm on the roof of the car, and turned and looked at the house and said, no. And I'm like, what do you mean? No. He said, it's moldy. It's like, you haven't been inside. You can't know that house is moldy. He's like, it's moldy. I'm not going in there. And I walked all the way to the front door and looked in the hallway and saw the mold that he had been able to smell from the street. So I have this personal mold detector that has been with me for decades, who just says, no, mold, no. So I've never lived with mold because he's so aware of it and so intolerant of it. And fragrance wise, we just don't bring, he doesn't tolerate flowers in the house. Whenever I receive flowers, I give them to the neighbours. So we haven't had pollens in the house. We don't have fragrance chemicals in the house. Nobody wears perfume in our house. And that's been the case for the entire time I have been with my husband. So it's just habit. And some of that was enforced because one person just was like categorically, no, I can't be in the room with that, whether it's the mold or the perfume or the flowers. So you can just, I don't know how to deal with stopping mold if you don't have your own personal mold detector like I do, but with flowers, with pollens, and with candles. When somebody gives us a candle and we feel deeply obliged to keep their beautiful handmade gift because it's a family member, I wrap it in Glad wrap and put it on display somewhere where hopefully no one will see that it's Glad wrapped, so that we don't have to smell it. But otherwise, candles just don't come into our house. People give, when the kids get given bath bombs or other smelly things, they get removed from the house immediately. You can just say no to a lot of things that produce smell in your house, but air filters and when necessary, negative and positive pressure spaces. Air filters is probably the most expensive thing that we do, and CO2 monitor as well was not inexpensive.
The exhaust fans that you created, I think, are much more beautiful than what I created recently when we had, unfortunately, had COVID in the home. I simply set up a pedestal fan, put it next to the window, and let it blast out of the window. It would definitely have been more effective had it have had the bike box casing, but in itself it was, you know, it was simple to use, and that was, you know, alongside other air purifiers. So I think, you know, just really simple use of, you know, low cost fans, low cost sensors, I think is a really useful way for people to just very quickly deploy something that's not that doesn't need to be high tech. It's just going to do the job, and that's what you need. And you've obviously found successfully that you didn't have any in-home transmission. We had the same, you know, the negative pressure was such a brilliant addition to our in-home infection prevention control strategy, that will definitely be doing that going forwards. I'm very conscious of time. There is a question here in the chat. This one's for you, Pippa. Is there a comparison? You obviously showed the CO2 in homes, in bedrooms, particularly when the doors are shut, and when the doors are opened. And honestly, if I hadn't ever had a monitor, I would never have known, and we would have, you know, always kept the door shut and the window shut. Is there a comparison between sleeping with doors open and doors closed? Are you seeing that? And I guess kind of to extrapolate the question, are the houses that you said, or the apartments that already have the air purifiers and already aren't doing the things to negatively impact their homes, are they the ones that are sleeping with the doors open? Is there a sort of compounding of negative, you know, the burning and the door shutting? Sorry, I'm not being very...
No, I understand the question, and I'll say that I have written down a prompt for myself to in a forthcoming pulse survey with my participants, to ask them, did you sleep last night with the door open, the bedroom door open or closed? And then I can correlate the carbon dioxide data that I'm getting in their apartment with what they've told me is what they did specifically in that last night. So the nature of a pulse survey being it has to be about behaviour within the last 24 hours. So that may be a way of me answering that question. I don't have the answer yet, because we don't have a way of determining. It's a little big brother, all of the data that we are collecting. So I think, you know, we don't have any sensors that tell us about people's opening and closing of bedroom doors, only the external balcony door and the windows. I will just say as a side note about monitoring and picking up on the conversation about the air mold. So there's the next pulse survey we do, we'll ask people about how they dry their clothes. And one of those things will obviously pick up on the behaviour of people drying their clothes in their apartment. And there'll be some follow-on about exhausting of laundries if they're using a dryer, or what kind. We actually know from our appliance review what kind of dryer they have in the apartment. So we know what options they have available to them. Anyway, it'll be interesting to see that relationship between what people say they're doing with clothes drying, also looking at the humidity data that we're getting in that apartment. And then also I don't know if it means anything, but one of the devices we're using actually gives us a mold algorithm. This is kind of where monitoring's trying to get clever, is it's giving us, you know, scores. So it'll be interesting from my own perspective, just as a bit of a data nerd and a bit obsessed with monitoring devices, is to look at the relationship between whether or not the data we're collecting in the apartment, what we know about the participants' behaviour, and then whether or not we're actually seeing in the algorithm from the device whether or not it is actually, you know, how accurate it is. So there's kind of, you know, there's a lot of ways of answering that question.
Yeah, fantastic. I think there are so many more. I'm really excited about this study because I do think there's just so much information to be gleaned, and it obviously is very big brothers because you're getting a lot of information from each home. But what a fantastic sort of data set it's going to provide at the end. So yeah, we'll looking forward to learning more. I'm super conscious of time and that I'm always a very bad chair who always runs over. So I'm going to give just 30 seconds or 20 seconds each for one final question, which would be what's the single most important thing that someone listening today could do to improve the air quality in their home? And we'll start with Beck because you went first.
Yeah, thanks, Plum. Well, I think it's ventilation. I think it's working out how your home works, how you're understanding where fresh air, the negative, positive pressure, what you can do. And then actually, if there's limits on that, working out what some other things you can do to address that are, it could be filters, it could be, installing mechanical ventilation, depends on your sort of home, but actually understanding airflow in your home and ventilation would be a really great start.
Mm-hmm. Fantastic. Pippa, you were second.
Yes, I would back up the comment that Beck just made about understanding where the ventilation is coming from in your apartment or in your home, and what are some low-hanging things you can do in order to optimize it. Ceiling fans, obviously move air around, but also fly screens if you can on your windows, just to encourage you to actually use them.
Yeah, fantastic. And Jo, lucky last.
Again, ventilation and knowing where your air is coming from, but coming back to people wanting to close their bedroom doors, something that we have done because we own this house and we're renovating it at the moment, shave the bottom of your doors, create an air gap so you can shut the door for privacy and still have airflow. It will also open up your rugs more easily. So this is one of those low-hanging fruit. If you don't have the DIY skills, you might have to pay someone to do it for you, but it's probably going to cost less than a ceiling fan, and it's going to cost a lot less than illness. Think about the small, simple, mechanical object things that you can do to change your space to improve the ventilation.
Fantastic. Thank you, everyone. Thank you for such a great discussion. I've really enjoyed today's discussion. I think there's so much exciting work being done in this space. I think it's fantastic, Jo, to really understand. Obviously have a similar household structure, but it's it's great to not be alone, and to be able to share the things that we're doing with others. Thank you, Pippa, for sharing the work from your study. I think it is so exciting, and thank you so much, Beck, for sharing the work that you're doing at the Healthy Housing CRE. I think the work there is really tremendous. So let's see what we can do to try and make it better for everybody living in their homes, healthier environments, for everybody. I think the really key takeaway for me is that we're all impacted by the air quality in our homes. And we could all be taking steps to improve our home environments. And I think just from a policy perspective, which is where my mind kind of always drifts, I do think that the sort of encouraging people to be monitoring in their homes so that they can make small behavioral changes, based on how their homes work, is one of the best opportunities that we have for improving the health of Australians. So thank you, everybody. I'm going to just bring this up in order to be able to say thank you. A recording of today's event will be shared across our platforms. We'd love for you to pass it on to your networks. A final thanks to our generous sponsors, AirGene, Camfil, Condair, Precise Air. If your organisation is interested in supporting our work, please do get in touch. We'd love to hear from you. If you've got any further questions for our panellists today, please do send them through. The address is info@saferairproject.com. I think I saw Amy pop it in the chat earlier. And thank you to all our incredible panellists today. It's been great to have you here, and thank you to everybody for joining us. We look forward to seeing you at our next event, which we're aiming for July. So thanks, everybody. I'll let you get on with your day, and stay safe.